Dr. McKinnon, what are some other conditions unrelated to inner ear problems that can be the cause of dizziness, like vestibular migraines?
Vestibular migraines are a unique form of migraines where the patient, instead of having a visual scotoma, which is the most common form of migraine, present actually with a sense of dizziness and vertigo. They very often will have a headache associated with the vertigo, but they don't typically have the hearing loss, which is much more suggestive of a condition known as Meniere's disease, an inner ear condition. The treatment of migraines often involves a similar dietary restriction as seen in Meniere's disease. However, we often don't use the other treatments for the inner ear that we do use in Meniere's disease. Very often, treatment of migraines will relieve the symptoms of the dizziness consistent with vestibular migraines.
What about stroke?
Stroke can mimic vestibular neuritis or serous labyrinthitis, where the patient presents with severe dizziness. But often the stroke will have associated symptoms such as weakness of the arms or legs, reduced sensation, difficulty speaking or swallowing. These symptoms are not typical for inner ear dysfunction, and when they present, often help identify whether the patient is having an inner ear issue or something along the lines of a stroke.
And then there's the question of tumors. Can tumors create dizziness that's similar to inner ear problems?
Yes, while they're very uncommon, one tumor known as a vestibular schwannoma will present with both hearing loss and vertigo. These tumors are diagnosed when the hearing testing and the balance testing show a weakness on that one side that cannot be otherwise explained. An MRI is performed, which will identify the tumor on the involved side.
What should a patient do to determine if his or her dizziness is caused by inner ear problems?
Patients who have symptoms that do not respond to routine treatment they receive should consider an evaluation appointment with me to help identify what could be going on. Dizziness can be debilitating, and we want to help our patients get their lives back, and very often we can help.